Good day, everybody. Welcome to part two of the lipolysis lectures, part of our aesthetic medicine series. Let's dive right in. So now we get to our cryolipolysis. We've moved away from our injectables and more onto the mechanical sort of area of lipolysis. Cryolipolysis is marketed as a non-invasive fat reduction technique using controlled cooling. The most common one is Cool Sculpting as the brand. Essentially, how it's meant to work is adipocytes are more vulnerable to cold injury than surrounding tissues. So, by essentially targeting fat cells with high levels of cold, low levels of temperature, um, you get adipocyte crystallization, which causes cellular stress, and then apoptosis. Again, leads to inflammatory clearance and a reduction in fat layer thickness. Changes develop normally over 6 to 12 weeks, so that's about 1.5 to 3 months. Your typical treatment areas for this are your abdomen, your flanks, thighs, upper arms, submental area, and back fat. The advantages over injections is that it's non-invasive, it's predictable contouring, it's widely studied, minimal downtime required, and does not require anesthesia. However, it needs multiple sessions, the equipment is quite expensive, and the results are, once again, modest. There's a variable response. Some people respond brilliantly, some people do not respond at all. Common adverse effects. Essentially, think of when you've held an ice block in your hand for too long. You can feel temporarily numb, you can get some swelling, some tingling, and some discomfort in the area. And then rare but important, you get paradoxical adipose hyperplasia, which instead of shrinking under cold, the fat cells enlarge. The way you know this is happening is because you get a firm area of enlarging tissue. It has a delayed presentation, normally onset of weeks to months. Generally, it's more common in males, and typically it requires liposuction correction. You can't fix PAH with more cryolipolysis, you're just going to make it worse. And it is quite uncommon, but it is probably the least desirable side effect of all of these side effects. So then you get radiofrequency lipolysis, or RF, which is the opposite. It generates heat within your tissues, which then causes adipocyte injury, leading to collagen remodeling, skin tightening, and improved circulation. Some radiofrequency systems combine the RF with microneedling and infrared light to sort of enhance the effects of each of them. Its advantages is that it can improve skin laxity, generally minimal downtime as well. It's a useful adjunct to contouring, but evidence is quite limited, results are very subtle, and normally requires multiple sessions as well. Then we get HIFU, high intensity focused ultrasound. In a similar vein to the heat treatments, the focused ultrasound creates thermal injury, which leads to mechanical disruption and adipocyte destruction. Only difference is the ultrasound can cause neocollagenesis, essentially means the formation of new collagen structures, which can lead to tissue tightening, smoother skin, that sort of thing. Its risks are very rarely nerve injury, but it can cause an uneven contour, pain, and even mild burns if not done appropriately. Then you get laser lipolysis, which deliver thermal energy into adipose tissue. The advantage is that these can be non-invasive, or they can be minimally invasive. It's called fiber assisted. It's essentially a long wire that they use to help direct the laser. Your effects include adipocyte destruction, skin tightening, and collagen stimulation. So, compared to our traditional liposuction, see there's a nice little table there summarizing everything. So who benefits most from these sort of mechanical lipolysis is those with good skin elasticity, realistic expectations, localized fat deposits, and those whose weight does not fluctuate much. It's important in those motivated to maintain their lifestyle changes because it doesn't help to go through all of this and then gain 20 kilograms and you've undone essentially everything it's done. Ideally avoid using these things in those with severe obesity. There again, diet is the main driver. It's also poor in people with major skin redundancy, i.e. people who have undergone excessive weight loss for whatever reason and now have loose skin. It can marginally assist with skin tightening, but 9 times out of 10, people with that amount of skin typically need surgical removal of it. And those with body dysmorphic tendencies are also not ideal because it just feeds into the mental aspect of it. And then, of course, those with unrealistic expectations. Again, it's not miracle drugs. Lifestyle recurrence. Destroyed adipocytes do not significantly regenerate, but the adipocytes remaining can still hypertrophy. Weight gain can reverse essentially everything you've done, so lifestyle management is essential. Remember, no aesthetic lipolysis procedure overrides caloric balance physiology. No matter how many injections you do, no matter how many sessions of cryotherapy or laser therapy you do, if you are eating in a surplus, you will undo everything that the treatment has done. So what are our ethical considerations? Avoid predatory marketing and avoid selling unrealistic fat melting claims. Always maintain informed consent standards and prioritize safety over commercial pressure. It requires a technical skill, good knowledge of anatomy, as well as ethical restraint and psychological awareness to know who it's a good idea for and who it's a bad idea for. So what's our clinical takeaway here? Injectable lipolysis, conservative dosing is typically safer. Important to know your facial anatomy. Swelling is expected and substantial in many people. Results require patience and avoid overpromising. Then with your device-based treatments, patient selection strongly predicts satisfaction. Combined approaches often outperform monotherapy, so doing cryo with laser therapy normally does better than just either or alone. And then your skin quality matters as much as fat volume. Because again, it does not help to break down the fat layer beneath the skin, and then if your skin is not healthy enough to retract, you just end up with a bunch of loose skin. So, summary. Lipolysis occupies an important niche in aesthetic medicine. It's best for localized fat reduction. Results are generally modest, but evidence quality between mechanisms varies greatly, and safety depends on training and anatomical knowledge. Among injectable therapies, deoxycholic acid has the strongest evidence. Mesotherapy cocktails remain controversial in the space, and again, not all of these compounds are standardized and regulated. Among your device therapies, cryolipolysis has the strongest evidence to actually work, and then your RF and your high frequency ultrasound treatments can help improve skin tightening. Appropriate patient selection is more important than the specific device or product used. And yeah, that is lipolysis. Thank you so much for listening to part 2 of the lipolysis lectures. and we will see you in the next aesthetic medicine lecture. Take care.